Baroness Meacher.
I beg leave to ask the question standing in my name on the order paper.
My Lords, government officials have been working with colleagues across healthcare and the wider system to ensure that where appropriate, patients can access medicinal cannabis. Clinical guidance has been issued by the Royal College of Physicians, the British Paediatric Neurology Association and the Association of British Neurologists. Specialist doctors will consider this before prescribing, but we are clear that the decision to prescribe should be one for individual clinicians to make in partnership with patients and their families.
I thank the Minister for her reply. The Minister will be aware, of course, that only about 4 people have received a prescription of medical cannabis since it became legal on the 1st of November last year. Doctors have had no training in prescribing cannabis. They need to know the contents, the dosages, the side effects and everything else about medical cannabis products. And the pressure on doctors from desperate patients whose standard medications are not working or are causing unacceptable side effects is intense, and doctors do need government help urgently. Will the Minister ensure that the NHS Medical Director makes specialist doctors aware of the new guidelines to be launched later this month by the Medical Cannabis Clinicians Society, and also to make doctors aware of the 12-module online training course already available from the Academy of Medical Cannabis?
Well, I thank the Noble Baroness for her question. This is a challenging area and the evidence base is still developing, but the government is working hard to ensure that awareness is increasing. This is why we've asked NICE to develop guidance which will be released later this year. We've asked HEE to develop a training package to increase knowledge and awareness amongst health professionals, and it's also why officials are working closely with suppliers and importers to ensure that when prescriptions are given, they are filled. But we do understand that there is work to do on this, and we will continue to work on this issue.
My Lords, following the
Will the noble lady comment on the issues illustrated in the predicament of a person who has been prescribed the cannabinoid dronabinol, branded as Bedrocan, which is the only medication that has proved effective for her following the failure of 35 different medications previously prescribed to relieve her chronic pain from cervical and lumbar spondylosis. Given that it was last summer that the Chief Medical Officer stated that there is conclusive evidence that cannabis-based products are effective for certain medical conditions, why is this patient still forced to travel to Holland every 3 months to obtain the medication which her consultant considers essential for her? And why does confusion still reign over licensing procedures? Will the noble lady the Minister meet with me and the person I've mentioned to see if she can introduce some more sense into these arrangements?
Well, I thank the noble Lord for his question, and I'm very sorry to hear about the situation that he raises. I am, of course, very happy to meet with him. What I would say is that there should be no reason, as I can see, for the situation that he has outlined. It is up to clinicians to prescribe as they see fit under the guidelines which have been put out, and I'm very sorry to hear of the situation that he's raised.
Lords, when the Chief Medical Officer recommended that cannabis medicines be rescheduled, she produced a report which showed that the most rigorous regulatory authorities in the world, those in the US, Australia, Ireland and indeed the World Health Organization, had strong evidence of the benefits of cannabis-based medicines for people with epilepsy. In light of that, surely 4 licenses is completely unacceptable. Why are UK patients being deprived of these safe and effective medicines which have actually fewer side effects than some licensed pharmaceuticals, such as sodium valproate?
Well, I don't accept the characterisation which the noble Baroness has just given. UK patients are not being denied access to these medications. They are able to access medications via a prescription from a doctor who is on the specialist medical register, and the government has acted fast with a review of the best clinical evidence and are going further with a nice guideline which will come forward, and also with further Higher Education England training package to raise even more awareness.
What troubles me, my Lord, of the noble lady's answer is
that, I've looked on NHS England's guidance, and it said that medical cannabis can only be provided where all other options have been exhausted and where there is published evidence of benefit. Well, we've heard lots of evidence of the benefit here just this afternoon. What I think we're right to be worried about is what is the research that's allowing that to happen, and why is it not happening quickly enough? And I think the thing that underlies this is, can the noble lady prescribe what level of opiate addiction and severe side effects of other medication can be tolerated before medical cannabis is prescribed?
Well, the evidence base for the quality and effectiveness of these products is limited, and it is developing. But this is why the government has asked the NIHR to call for proposal in order to enhance our knowledge of these medications. However, we have not waited to do this. We have introduced a route via the unlicensed medications, which allows for doctors who are on the specialist register to prescribe for patients. This is the right route because these are the doctors who will understand the conditions which are most likely to benefit from prescription, and they are the ones who are able to make a judgment about the safety and efficacy of medicinal cannabis, and that it is the route which is usually used for unlicensed medications and is the one which the MHRA has set up in already. We want to see more licensed products in this route already, though, so we do also call upon industry to invest in more trials and publish the results and the full underpinning data to build our knowledge in this space so that more patients are able to benefit.
The majority of those who have been guilty of violent terrorist crimes in this country, we have found, are heavy users of cannabis. When one looks at violent crime outside of terrorism, again, and I don't know the details of this, but it does seem that very often the people involved are heavy users of cannabis, skunk, not the stuff we're talking about, the liquid stuff. Could I ask the noble lady minister, is the government actually looking at the relationship between use of these really, really strong types of cannabis and violent crime to see if anything should be done about it?
Well, the types of medicines that we're speaking about are not skunk, and he is right that all medicines carry risk, but they can also be beneficial. That is why we have introduced a route to allow for medicinal cannabis for those medications for those conditions where it will be beneficial. But the change in the law allows strict access via specialist doctors who, in making the decisions to prescribe, can ensure that the benefit outweighs the harms to the patients, and the restrictions are in line with the advice from the ACMD. Any further concerns around the kind of drugs which he is talking about are still strictly controlled by the Home Office and policing.